What's up, guys? It's Dr. Ryan coming to you with another video review of one of the Step 1 Free 120 questions. In this video, we're going to take a look at Block 2, question number 10. So this question describes a 46-year-old woman who has pain with urination and increased urinary frequency. When her urine is examined under the microscope, there are white blood cells and bacteria. And so based on this information, what they want to know is which of the following is the strongest risk factor for the development of this patient's condition. And they give us 4 answer choices, which I'll let you read yourselves. Okay, guys, this is a pretty straightforward question. The first step to answering it is to recognize that this woman has a urinary tract infection. This is a classic presentation of a woman with a UTI. She has pain with urination, that's dysuria. She has increased urinary frequency, and you see white cells and bacteria under the microscope when you examine her urine. Once you know she has a UTI, they're just basically asking you for the strongest risk factor for development of a UTI in a woman, and the answer is answer choice D, sexual intercourse. Sexual intercourse can directly introduce bacteria into the urinary tract in women, and therefore it is the strongest risk factor for development of a UTI. As to the wrong answer choices, answer choice A is leiomyomata uteri. This is uterine fibroids. This is incorrect. Uterine fibroids have no effect on the risk of UTI. This question writer probably threw this in here, hoping some students would just think, oh my God, I didn't study fibroids enough. Probably there was something about UTIs I missed and would jump at this answer, but it's not correct. It has no relationship with UTIs. Answer choice B is perimenopause. This is also wrong. The drop in estrogen associated with menopause can change the vaginal flora and slightly alter the risk of a UTI, but this is nowhere near as strong a risk factor as sexual intercourse, which can directly introduce bacteria into the urinary tract. And then finally, answer choice C, pregnancy. This is also not correct. There is an increased risk of UTI in women during pregnancy. This is because progesterone affects smooth muscle function, so you don't get the normal urinary flow through the system. But that increased risk of UTIs in pregnancy is very small compared to sexual intercourse. If you just think about it logically, a change in hormones is going to have only a minimal risk to UTI compared to sexual intercourse, which directly can introduce bacteria into the urinary tract. And that concludes our video review of the Free 120 Block 2 Question 10.